Good afternoon, everyone. If you could please take your seats. We're a little past our start time, and we want to get going because we have such an exciting afternoon. All right. Welcome to the third and final annual meeting of the um, Judicial Commission on Mental Health for this year. Delighted to see all of you in person. It's a real treat to be in Houston, and I am not going to give lengthy remarks because we have a very exciting afternoon going over to the diversion center, and I want to be sure that we keep on time for that. So I'm going to turn it over to my colleague and co-chair, Judge Jesse McClure.
Thank you very much, Jane. And I too wanted to express our excitement and our gratitude to Wayne Young for setting up the tour of the center. That's at 2:30 following this meeting. You should have a committee meeting notebook in front of you. Tab 1 contains the agenda. Tab 2 contains the list of the members of the JCMH, the Executive Committee, the Commissioners, and the Collaborative Council. The meeting minutes from the last meeting should be in tab 3. And as you peruse those, if you find anything that needs to be corrected, please see Michael Garcia, who spent a lot of time handling the minutes from the last meetings. And in tab 5 has the budget, and Patrick Passamore's here to talk about that as well. So if you have anything you want to know about the budget, please see tab 5. And now I will turn it over to my good friend, Justice Huddle.
Well, good afternoon. Thank you for being here today. I have some sad news to share with the group, and that is you may have known already that JCMH Commissioner Vicki Rice passed on July 5th after a courageous battle with cancer. Vicki was an extraordinary presence here at JCMH. Anyone who had a conversation with her or listened to her came away uplifted by her bright and joyful smile. And so we wanted to appreciate, again, all of her contributions and together mourn her passing. May her memory be a blessing.
You have to hold it, Judge.
Hold it. The whole time I talk, or just?
Yeah,
Oh, okay, got it. Thank you, Justice Huddle, for the opportunity to pause and remember Vicki. And your words help us carry forward her spirit as we continue today's program. The staff worked with Vicki's colleagues to put together a small tribute to Vicki in the JCMH Biennial Report, which each of you received under your meeting notebook. I recently had the pleasure to join the September Collaborative Council meeting, and it was really truly exciting to see so many passionate individuals and a wide array of professionals who care deeply about improving the administration of justice for those with mental health needs. I see some of my new friends over there. And if you look under tab 2 of the meeting notebook, you'll see that there's some new names under the Collaborative Council members list. And on behalf of JCMH, I'd like to extend a warm welcome to our new members and express our gratitude to them and our returning members for their commitment and service to the Commission. I'm excited for the new vision we have for the Council that will help the Commission grow its efforts. JCMH Senior Attorney Daniela will report out that new vision later in this meeting. Now we will go to Christy Taylor for her Executive Director report.
Thank you, Judge Parker. I am going to follow Justice Bland's lead and be brief, but I have such joy setting up this room and welcoming all of you back. When I look at your name cards, I remember all of the contributions you've made and the places that we've visited around Texas. And so we know that you have traversed our great state to be here, and we know you're extremely busy people, and we really appreciate it. I also have to thank our staff. This is quite a lift. We have moved this commission meeting so that we get this time together to align with the summit, but we are at the same time producing the bench books that you'll receive at the summit tomorrow. 2 new additions. They're beautiful. They truly represent the work of this room and the probably hundreds of years of experience that you all represent. Judge Parker mentioned our biennial report. Rose will talk about it, but I hope you take time to look through and see your own face and the faces of the people that you represent. It's a really a lovely document. I also wanted to just thank you all that you bring the information to us. And I just want to remind you that our staff, even though we have lots of experience, we are no longer in that daily rhythm of your jails and courtrooms and hospitals. And so we rely on you to bring us the information of what is working, what is not working. And a good example of this, we just had an emergency detention roundtable where we discovered differences between counties that are interpreting the law in different ways because of their needs and all the variations that we have. So it was really illuminating to discuss how the statutory structure was set up and then how it's being interpreted in different places. So we're working on that report and we'll get all that to you. But it was such an important meeting and function that you were all able to represent the different parts of the state and tell us how that's working. Again, I want to thank Denise Onken and Wayne Young. This is our first field trip that we're going to take today, and so we're so excited. I will now turn the agenda over to Patrick to go over the budget.
You have to hold it? Okay, thank you, everyone. Thank you, Christy, and good afternoon, everyone. You'll find that budget report under tab 4 of your meeting notebook. This one's going to look slightly different than the one that you've seen in the past. I've added a little bit more detail since we're closing out fiscal year 2025 and showing the new budget for our fiscal year 2026. So starting from the top, you'll see under FY 2025 funding, we had just under $412K in the bank in combined payables and encumbrances to match that amount, meaning we're not anticipating any lapse of our fiscal year 2025 appropriation. Moving down to the next table, FY 2026 funding estimate. The base appropriation was increased by $65,000, which represents a 10% COLA that was passed in the 88th legislative session. So that's just rolled in now to our base. Below that are items that were passed recently in the 89th legislative session and include $47,000 to increase all court staff salaries by 6%, $28,500 to increase all licensed attorneys working for the court by an additional 6%, $75,000 for JCMH to hire a new program specialist, which will be having an application out soon if it's not already posted, so if you know anyone. $52,000 to compensate for increases in operating costs, and $1.5 million to expand the court liaison pilot program to 5 additional Texas counties. Finally, a grant from Texas Tech University to continue the Forensic Psychology Fellowship, a project that Daniela had been working on prior to joining the commission, and that's going to come in at $25K. So this brings our total available funds for FY 2026 to just over $3 million, and that's an increase of $1.7 million year over year. Moving now to the FY 2026 budget, we've allocated $970 for operating, $655,000 for commission projects, which you will get an update from the staff here shortly about. And then in the grant section is that $1.45 million to expand the court liaison pilot program. And finally, an allocation for general scholarships that are going to be available to attorneys and judges. So this brings our total budget expense to just over $3 million. And with that, we'll have a potential UB from FY 2026 of just over $8,000. And that's all I have for this budget overview. If there's no questions, I will pass it on to Justice Boyce to update you all on the past legislative session.
Justice Boyce emailed and said he may be delayed a little bit, so we'll skip his report and hopefully we'll catch him when he gets here. And if not, we can update you on the legislative successes of this last session, in addition to the additional funding for county-wide programming that we're expanding. There were other legislative successes that he can go over. So we'll turn it over to OCA and Jeffrey Sunakawa.
Thank you, Justice Bland. My name is Jeffrey Sinikawa. I'm here for the Office of Court Administration. You typically hear from Megan Lavoie, our Administrative Director, who couldn't be here, but I'm happy to share some updates. There's usually a lot going on at OCA, and we could usually talk for hours, so I'm actually delighted that I only have a few minutes to give you some updates. Judicial Council, as the first priority, has actually been pretty quiet since the Commission last met back in April. A lot of the attention for Chief Justice Blacklock was on special session and the court omnibus bill, which finally passed in this last special session. So now that legislative session is hopefully over, we can focus on Judicial Council priorities. We expect the Justice Blacklock to convene committees here this fall to start the work of planning for next year, and hopefully some recommendations from those committees that will lead into the next legislative session. A few projects that I did want to highlight that I thought might be of interest to the Commission, and Megan thought so as well. As you probably realize, there's been a huge increase of attention on judicial security and judicial privacy, both nationally and statewide. We actually had two bills that passed this last session, HB 5081 and then the Court Omnibus Bill, House Bill 16. Those two bills actually did quite a bit of allowance for judicial privacy. In House Bill 16, there's actually language that will now allow court staff to have their information removed from government websites. So county registrar's office, from driver's licensing, from the appraiser's office. These are privacy protections that judges already have, and the legislature extended those privacies to court staff. HB 5081 is actually what we call the data broker bill. This bill actually provides protection for judges, their immediate family, and court staff from having their information on the internet. So we're actually working on an RFO right now so that individuals can contact professional companies that do this for a living and have their name removed from data brokers' websites so that's not shared and spread all over the web. In terms of judicial security, we have just wrapped up our statistics for the last fiscal year. We've had a 97% increase in judicial security incidences that have been reported to us from across the state. So we had about 2,200 incidences. Those ranged anywhere from seized weapons coming in through the courthouses, threats, disorderly conduct, physical assault, and other issues. The only statistics that we have are what's reported to us, but we've seen a dramatic increase over the last couple of years. Last couple of updates I'll just provide. We're actively working on an RFO for the public safety report system. For our judges who are familiar with that, that is a system that judges use when they're setting bail across the state. That was SB 6 back in the 87th legislative session. Our contract is actually up at the end of August of 2026, and so we're currently reviewing those contracts and doing an RFO to see if we're going to be changing systems. And then the last project I'll mention, this last session we were allocated about $4 million for a statewide case management system specifically for specialty courts. So this is your adult drug courts, your juvenile drug courts, your mental health courts, your veterans treatment courts. We will be working on that RFO this fall and making that case management system available to any court that operates one of the 208 registered specialty courts across the state. Erin Morgan is our program manager. I think she spoke at the last meeting, introduced herself. She oversees the best practices for specialty courts across the state. So she'll be leading that effort. She did want me to share that over the last year, for over half of the new specialty courts that were registered with OCA were mental health courts. So we're really excited to see that there's been some improvements in establishing those across the state. There are still several counties that are required by statute to actually have a mental health court. And so that information is on our website, and we could use all the advocate and evangelism that we can to get those mental health courts set up. It's my very brief update. I could talk about a lot more at OCA, but we have a lot more to get to, and I will now pass the report over to our two jurors in residence, Judge Brent Carr and Judge Bisha.
Thank you, Jeffrey. Okay.
You have to hold it.
Gotta hold it now. Yeah. Thanks, Jeffrey. Okay. Most of you know that one of the most visible areas of the JCMH impact has been SIMS mapping. SIMS is an acronym for Sequential Intercept Model, which was developed by the Gain Center in the Substance Abuse and Mental Health Services Administration. The SIMS provides a framework for analyzing the points in the justice system at which a person with mental health needs, substance use disorders, IDD, can be intercepted and hopefully diverted from further involvement with the legal system and instead directed into behavioral health care and other services. If you haven't been in one of these SIMS mappings, you need to do it. Amazing things have resulted from SIMS mappings. It's a deep dive, plus then the individuals come up with strategies for how do we go forward from here. JCMH has held 19 SIMS mapping workshops for adults and juvenile legal systems around the state. In 2025, JCMH has mapped the juvenile justice systems in Bell, Burleson, and Kendall, and in early December in Hutchinson County, and next week in Lubbock. During these workshops, community members who organize into teams to work on priorities for the change that they've established. The identification of mental health needs before entanglement with the legal system and the improvement of transition between detention centers and the schools. Across the state, judges bring people together and lead the conversations about improving systems for all Texans. If it comes to your community or a nearby community, you ought to go. They have really been a great program, and the fact that we've done 19 of them since 2021 is pretty amazing. And I'm going to turn this, and now I'll turn this over to the Honorable Brent Carter.
Thank you, Judge. Let's see. As they stared longingly into each other's eyes. Oh, I'm sorry. That was the wrong report. Let me get to the correct one. We have started a very interesting conversation because, as most of you know, most of our counties do not have the population of Harris, Dallas, Tarrant. So we're going to start focusing some effort and resources towards rural issues. We put together something that we're calling the Rural Issues Committee. And we had our first phone meeting on September the 22nd. We had a lot of people attended the call, and we invited and had short presentations from the Texas Health and Human Services Commission, the Hogg Foundation, and Texas County of Community Centers. So we're not trying to reinvent the wheel here as a commission. We're not a service provider, but we can certainly work together to enhance delivery of services, whether it be things like telemedicine, transportation, be there in support as these various entities seek legislation in order to fund some of their undertakings. We also heard from the various parts of the states about what they saw on the ground, what gaps in services that they're experiencing, and a lot of it was kind of what we thought they would say. It's just that there has not been a coordinated effort to put the package together and make any meaningful success with it. So that is, again, where we hope to be able to step in and provide a little bit of horsepower. In that regard, we have us a superstar organizer, our legal assistant, Michael Garcia, who was vital in coordinating this while he was working with the other staff on putting the conference together. And again, Kama and team have done a great job. And so I want to certainly thank Michael for his assistance. We're looking for some more help on this project because, you know, I know young Judge Speech over there is just a young pup, but I'm not getting any younger. So I'll hang around 2 or 3 more years, maybe, as long as Christy doesn't kick me out. And but we are looking for some people on the commission or the resource council to pick up the ball and help us run with it. And we encourage that. Michael has a little survey he can send to you if you're interested. That'll kind of help us know what your interests are and where you'd like to see us go. And that's the biggest thing I've been working on recently. And now I would like to recognize No, Judge Parker, the longingly into each other's eyes is not in your agenda, so quit looking for it. I would like to turn it over to Kama.
Thank you, Judge. Okay, on that note. So, as many of you know, the Bench Book and the Summit are my two main projects with the JCMH. So that is all culminating this week, right here, right now, my two biggest projects, and then I'm considering vacation, but I'm really looking forward to this week. I want to first thank the Summit Committee and the Bench Book Committee for all their hard work, really working tirelessly to make both of these projects come together at the same time. Thank you, Judge Carr and Judge DeBose, who are the chairs of those committees. These cornerstone projects wouldn't be nearly as successful without their leadership and their guidance. And additionally, I wanted to thank Rose McBride, who is co-directing the Summit this year. So with the double legislative sessions and the Bench Book needing to be printed earlier because the Summit is earlier, we wouldn't be here without Rose and all of her heavy lifting this year. So thank you so much. So the adult and the juvenile bench books will be provided in your welcome bags. Please email our office if you would like more sent to your office. We're gonna have to get another round printed and then we'll mail from there. So there aren't quite enough for everyone to take them back to their office other than the ones we can hand out with the Summit. And I'm excited for you guys to explore the new bench book and see all of these outstanding presentations over the next few days. Please come to me if you have any questions or concerns or thoughts for next year. And I'm gonna send it to Christy.
Thank you, Kama. Let's see, there I am. I want to introduce our newest hire. Many of you already know her because she was very involved with the commission as a collaborative council member. Daniela Jimenez Chisholm is a 13 or 14-year attorney. Okay, she came to us with a lot of experience as a defense attorney and then with the county attorney's office and became somewhat of a national expert in assisted outpatient treatment. So it has been an exciting move for us to be able to focus more on civil law, civil commitment that we haven't really had that expertise before, even though Kame and I were doing our best to learn it. So I would just like to formally introduce her, and now we're going to turn it over to her for her report.
Thank you all. I'm so grateful to be here with you all and to be of service to JCMH and to the commissioners and collaborative council. Just last year I was there and now I'm here, so very excited. Want to share with you some updates on the projects I've been working on since joining JCMH. Alongside Kama, I've been working on the juvenile bench book, the counterpart to the adult side, making it more user-friendly, adding legislative updates, and excited for you all to get your hands on those tomorrow in your welcome basket. The Collaborative Council, I want to thank Judge Parker so much for attending our most recent meeting. The council is shifting towards actionable projects that we can report to the commission. Our aim is to provide the commission with direct, practice-level experience and perspectives from those professionals working closely with these issues, while we support the council members through in-person meetings, that'll be new for us as well, and also resources to address professional burnout. With so many juvenile experts that engaged with the council, there was strong interest in forming a juvenile committee to ensure that these issues are addressed with depth and focus. As you heard from Patrick, we received significant funding for the court liaison program, where we will be able to provide funding for 5 new counties for that program. And this expansion will focus on systemic efficiency and data collection, helping us to measure impact and outcomes more effectively. The final project I've been working on is the Texas Mental Health Law Courtroom Curriculum. This is a law-based curriculum integrated into psychiatry residency programs focused on the civil commitment process. It's been piloted at Texas Tech University Health Science Center in El Paso and is now being developed for use in other medical schools around Texas. The goal is to better equip psychiatry programs with knowledge and tools for real-world courtroom practice while strengthening collaboration between clinical and legal professionals. Thank you, and next up is Andy Perkins.
Thank you, Daniela. First, I wanted to provide some updates on our technical assistance projects. Judge Spisha told you what we've had going on with sim mappings. More information on that process and the applications are available on our website. We have a flyer at our resource table. We've also got some mappings scheduled for the rest of this year, one next week in Lubbock and one closer to the end of the year. It's December 14th in Hutchinson, so I'm very excited about those. We also offer other types of technical assistance. This is expert consultation, professional networking, answering questions that come up in practice. At the end of September, JCMH has completed 68 requests in 2025, serving hundreds of partners in 32 Texas counties, many statewide groups, as well as individuals and organizations from Maryland, Oklahoma, and Pennsylvania. We're very proud to be the experts and to help when these questions come up, and please continue to send us those questions. I have the privilege of helping with the Data Committee, chaired by Chief Medina and Dr. Almeida, as well as the Substance Use Disorder Committee, chaired by Judge Nelson. We're doing exciting things on both of those. If you would like to join, we would love to have you. And finally, we continue to highlight notable and novel programs on our innovations map online. These updates come when we learn about something new and interesting going on in the state. So if you have something that is not on that map and should be, let us know. We'd love to help you publish the successes that you have across the state. Next up, we'll hear from Rose McBride.
Thank you, and move a little bit closer. Whoops, okay. We're very proud to present the biennial report to the Supreme Court and the Court of Criminal Appeals. So this comes out, as the name suggests, every 2 years. We adjusted our timeline this year to match the state's fiscal year, so the report is going to highlight the work of the JCMH from January 2024 to September of 2025. The theme this year is Real Texans, Real Impact. All of you are going out and making a difference and an impact in your communities. So in this report, we highlighted Texans throughout the state, some being commissioners and collaborative council members who have benefited from and supported the work of the JCMH. So you'll see those highlights at the bottom of some of the pages in the report. The report is designed according to our mission, showing the ways in which our projects have exemplified collaboration, leadership, and education, as well as a future outlook for some of our projects that we're going to start within the next year. There's, I believe all of you have a copy. There's also a copy on our website. Since our last meeting, we've published 6 new episodes of the Reimagining Justice podcast, highlighting innovative programs throughout the state in Fort Bend, Bell, Bear, Williamson, and McLennan counties. The podcast is available on both Apple and Spotify podcasts. I also wanted to mention this summer we brought the summer webinar series back for our 2nd year. This year the topic was IDD law. Our 3 webinars included IDD 101, civil commitments of people with IDD to SSLCs, and forensic commitments of people with IDD to SSLCs. All of these recordings are available on our YouTube and available for CLE. You can find the links to those webinars on our website, which is under the Programs and Innovations, or Initiatives tab. And finally, we're looking forward to the summit. I really enjoyed helping KEMA this year get everything ready and together. We are asking that you share your photos on social media, and if you do, tag us. We are on Facebook, Instagram, X, and LinkedIn. We'd love to share your experiences that you are having here at the summit. And for all those, our account is Texas Judicial Commission on Mental Health. You can just search us. And I also wanted to mention for the 2nd year in a row, we have registrants from all 254 counties in Texas. Very exciting. And I want to thank Judge Carr for helping us get to that number. He has made some new friends along the way and helped us reach out to people in communities who may not have heard of us or may never been to the summit. So thank you, Judge Carr, and I'm really looking forward to this week. I will send it back to Justice Bland.
All right, before we hear from our standing partners and their updates, our Vice Chair, Justice Bill Boyce, is in the room. And we're so excited to have him to give us a brief update on legislative events and successes. And his role as vice chair of the commission, he has really taken ownership of what is a very big project, which is keeping track of changes in mental health law and helping shepherd many of you who come with good suggestions about changes that need to be made to our statutory framework and getting those into, with the help of Professor Shannon, getting those into format that the Judicial Commission can then, not the Judicial Commission, the Judicial Council can then review and determine whether or not to make it part of the judiciary's effort to engage with the legislature on this topic. So without more, Justice Boyce, take it away.
Thank you, Justice Bland, and good afternoon to everybody. I'm going to give a very brief report on the legislative committee. It's an important part of the commission's work. It has been since the commission was instituted. It studies and recommends improvements for statutes and rules relating to mental health and intellectual and developmental disabilities. And I want to make sure that the happenstance of my speaking here this afternoon is not mistaken for the hard work of that committee, and particularly Professor Shannon, who has done yeoman's labor to shepherd through meaningful, important, and impactful changes to statutory frameworks. I want to share some updates for you very briefly about the progress of proposals under the current legislative session. Chief among these, Senator Zaffarini introduced Senate Bill 1164, which was signed by the governor and went into effect on September 1, 2025. The bill made several important changes to existing statutory law, including updates to the law enforcement emergency detention form, clarifying a peace officer's duties in an emergency detention at a facility, clarifying court-ordered mental health services venue, and refining the capacity standard for civil commitment. Additionally, to clarify some of the confusion caused by a subsequent drafting error, Representative Leach introduced House Bill 16 during the special session, which effectively repeals sections 8, 9, and 10 of Senate Bill 1164. House Bill 16 was signed by the governor on September 17th with immediate effect. Next, or I may have this out of order since I'm out of order, so I think I will return the mic to Justice Bland to observe the due order.
Great. Thank you, Justice Boyce. Okay, so we're to partner organization announcements, and a couple of our organizations sent in written summaries, and Christy's going to go over those with you. And then I think we have Dr. Simpson here from Health and Human Services. There you are, Jenny. Okay, so we'll hear from Dr. Jenny Simpson and what's going on at HHS.
Okay, thank you. Good afternoon, everyone. I'm Jenny Simpson. I'm representing Deputy Executive Commissioner Scott Shacklin, who is over the Health and Specialty Care System at HHSC. The Health and Specialty Care System oversees our state supported living centers and our state hospitals, as well as our 1 and soon 2 youth residential treatment facilities. So just wanted to give a brief overview of our construction, just to give you an idea of the capacity that is expanding. So we're very excited that in December, the Dallas State Hospital will be opening. That's our estimated completion date. We will have 200 adult beds opening in December. And then in early 2026, we will have pediatric beds coming online as well, 92 of those pediatric beds. In the next couple of years, in 2026, we have 3 projects that are going to be coming online, or estimated to come online. That is the pediatric beds. We'll also have 40 adult geriatric MSU beds at San Antonio State Hospital, as well as opening the Terrell Center for Youth. That is the new 30-bed youth residential treatment facility. And then in 2027, we have 5 new construction projects that will be coming online. 3 of those are new hospitals. That's the Panhandle State Hospital, the Lubbock Psychiatric Center, and the Rio Grande State Center. And then we'll have 2 replacement facilities. So replacement for Wichita Falls State Hospital, and then for Terrell State Hospital as well. So that's 9 projects in total that are coming online in the next 2 years. I know that's a bit to project forward, but we are increasing capacity, and that's really thanks to that $2 billion investment by the legislature in bed capacity. 2 things I just wanted to mention. We continue to see, and this has been year over year, an increase in demand for beds. So that's the number of individuals who have been put on the wait list for competency restoration services. So we can continue to see those go up. However, our average length of stay for those individuals has gone down from 418 days in FY 2022 to now we are discharging folks in an average length of 201 days, and that's discharging from the hospital. So we've really, cut that almost in half. I'm excited about that. One thing to mention, we are seeing a really an increase in how long individuals found not guilty by reason of insanity are staying in our state hospitals. So in 2019, FY 2019, it was 487 days that an individual who was in GRI was stayed in our state hospital facility. In FY 25, that went up to 1,317 days, and that's a 300% increase. So I mentioned this because just to kind of give how this impacts the system. If you think about this is 14% of our beds that are represented right now in our state hospital facility. If you look at that, the time that someone were just, average on that 1,300 days, that takes a bed offline for 3.6 years. And so that, I just want to make sure that that's also something that we're talking about is not only how many people we have on our waiting list, but also how many people we are able to discharge out of our state hospitals, because that back door is also key to increasing the supply, that front door opening. So just 2 of those, just those couple of updates, but I'm happy to answer any questions too or after this. I know we're on time here, so keep this short.
Okay, great. And we're going to hear from Emily Eisenman with the Texas Department of Criminal Justice Rehabilitation and Reentry Division.
Good morning, afternoon, I guess. Yes, I'm just filling in for Miss April Zamora. We are very excited to announce we do have a new division name. We are Rehabilitation and Reentry. I just saw in a few places we're still reentry.
So you used to be Tacoma, right? That's what
we are still Tacoma.
Still Tacoma, and then what's the acronym going to sound like for all of us?
Sounds good. So I always say I'm a little old school. I still say Tacoma, TCOOMMI.
Oh no, I meant the new name. You reorganized your division?
So yes, our division is Rehabilitation and Reentry Division instead of Reentry and Integration. But Tacoma still is an office within that division, the Texas Correctional Office for Offenders with Medical or Mental Impairments. So we're very excited with some of that restructure, efforts to kind of integrate and streamline some of the substance use, mental health co-diagnosis services are ongoing within our agency. I know Ms. Zamora spoke about some of that with you all during the last session. Tacoma had requested some additional funding through the legislature this last year to expand an opportunity to serve more dual diagnosis residential beds with our probation partners. And we did receive about half of the funding that we had asked for that. So we've already implemented, and our LMHA partners have started to hire, which is wonderful. The legislature also graced us with some additional funds that allowed us to start returning services that we'd had to kind of pare back on as salaries and just overhead costs had continued to rise. And so we're working diligently with where populations have moved across the state in the last few years. And we've got some exciting pilot projects with the Juvenile Justice Department and how that continuity of care network really works out are some of our big things that have gone on. Thank you.
All right, and we have a couple of reports from our standard partners that they sent written comments. And Christy's going to give us those updates.
Okay, so Matt Smith from TJJD wanted to report a couple of things. We had several partners that had conflicts and that may be here throughout the summit, but perhaps couldn't be here today. So he wanted to report that there are new builds, that there is momentum around the new state-of-the-art facilities in Ellis and Brazoria counties, $104 million in funding, which brings the total project funding to $304 million. Very generous. Both of the 104-bed facilities have received key legislative approvals, and the design is now underway. So 2 key dates, the constructions begin on April 2026, and the completion target date is October 2028. I thought this was interesting that the Ellis facility will serve youth with the highest level of mental health needs, while the Brazoria facility will focus on youth with the highest levels of violent behavior. The targeted service models are both created to create safer communities and to also transform young lives. Another announcement from TJJD is that they are ending a 2-year planning and assessment project that they worked with the Meadows mental health policy on. I think he's reported on this before. They used this 2-year OJJDP funding, that's the national TJJD, to help create the new regionalization plans. So there's going to be new positions, 7 new regional continuum of care positions, and 1 statewide continuum of care manager. This is supposed to come on board about mid-November, and the goal is to help support the local juvenile probation departments. I don't know if Maggie knows any more about this or any of our other probation department partners, but it says this is what the goal is for that project. They're also pursuing additional grant funding from OJJDP to focus on the implementation phases and all the different recommended strategies that they got from this regional and statewide mapping. Any other comments on that, on TJJD? Okay, I am now also going to be Chief Standridge. So he could not be here, but he sent a detailed report. One exciting thing is he has undertaken a huge lift in San Marcos where he is the chief, and then he also, I think, still serves as the chief of the statewide organization for police chiefs. But in San Marcos, they are training every frontline sworn employee as a mental health peace officer. So that is a huge accomplishment. He says will be accomplished by the end of the year. He reports that the state still needs more extended observation units, that it is normal for MCOT teams to call law enforcement and ask that law enforcement transport to hospitals that are 3 to 5 hours away due to the bed availability. He said these commutes are impossible to navigate. Agencies are expecting to transport the clients immediately, and it takes a minimum of 2 personnel, law enforcement personnel, off the streets for this round trip. He's also noticing a problem that even our inpatient acute care is lasting an average of about 7 days from their perspective, and that law enforcement is noticing that even when they're being discharged, that they are not quite stabilized. And so he is finding that they are being contacted again and again for some of the same people. Chief Standridge estimates that 20% of all their calls involve the frequent utilizers. To make matters worse, he says fire and EMS departments are also making these calls, and sometimes without law enforcement involvement. So the costs are extraordinary, and no one has really fully contemplated case management across all of these systems. So he is requesting, at a minimum, that JCMH research the feasibility of a data management system that crosses systems and fosters actual case management for high utilizers. And so I would ask any of our commissioners that have expertise in this, I know there have been legislative efforts in the past couple of sessions to develop either a statewide data management system, or there have been private vendors that are willing to just go into one community and do a closed circuit for a large community. You know, he is very, very persuasive. So he says it can be done if there's a will to do it. He also would like to report that more law enforcement agencies are implementing behavioral threat assessment teams that will address both juvenile and adult clients. This is a group of professionals that convene to identify, evaluate, and address threats that are potential threats of targeted violence against a community. However, an issue that lies among the juveniles and what is shared among the LMHAs and law enforcement is that case management is not being addressed by both parties. Information is not shared and unless there are subpoenas. So he was noting this as a highly problematic issue that warrants more review. And he apologizes for not being here in person. They had a death in the family.
That's a great report, and we need to think about what we can do on the data front and the legislative front. And Judge Wheelis?
Hold it. Keep it down the whole time. Wreck 'em. All right, so Chief brings up an excellent issue because the behavioral threat teams are out there, active and wonderful. However, as a judge, I can't ex parte about the facts at the scene. And so we're gonna need, I think, Professor Shannon and Justice Boyce to address some sort of carve out, if you will, for that behavioral threat team to not include the judge, but include rather the juvenile probation director or chief. So, thank you.
Yeah, good note. Okay, and Judge Wheelis let us off. Are there commissioners that have announcements or reports they want to give? And I ask that you keep your comments to about 2 minutes.
While you're thinking for a minute, I wanted to jump in and reiterate the announcement about the Court Liaison Project. Daniela had mentioned it, and we have changed the name of this project over the years, so I wanted to emphasize with all of you as our leaders that it's such a great opportunity. This is the project that we hosted 4 years ago, started with HHSC, looking at what counties really needed that coordination. And we fully funded for 2 years, and then stepped down funded for 2 more years in Grayson, Denton, and Smith counties. And so I know that Judge Phillips is here, and he has been a wonderful champion of this, and Judge Jan as well, because it has led to so many other improvements and collaborations within the county. And we will be opening that up in the new year, and we definitely will look at need and make room for the mid-size or rural counties, but we are not ruling out the larger counties if they don't already have someone in this role.
Judge Chan? In the annual report, there are blurbs from some of our people that have, the commission that have participated, and then also from the liaison officers themselves. So if you're interested in what they do, look at it. And Judge Phillips?
Yeah, I'll just follow up. Thank you, JCMH, for allowing us to have a court liaison. I would highly recommend your communities to look at this. our county, which we're not one of the large counties. We're not a tiny county, but we're working the best we can. And our commissioners are continuing to fund that project 100%. And so we never would have gotten that had it not been for the initial start. So thank you. And from that, so many things have developed. We're in the process of hiring a criminal magistrate to magistrate people in the jail. But one of their main responsibilities is to be the director of our mental health coordination. And so that we're making sure we're following the law and getting 1622s done. As much as we stress it and push it, we've got our Commissioners Court to fund that position. And so we're excited to find somebody to come in and not only follow the new statutes, but also make sure that we're identifying early those that have mental health issues. Lastly, I shared maybe the last time, our local mental health community action group takes on behavioral health leadership team. We got $1 million grant from essentially the Kendra Scott grants across the nation. And so with that, we looked at a diversion center. Financially for our community, it didn't make sense. So we're embedding in, we're enabling our local mental health authority to hire employees to crisis to be embedded in the police departments. We've had a model for a year doing that with our largest city, Sherman, and the results seem pretty remarkable, and they're keeping good data about it, so that'll help some of you guys. With that funding, we'll start in our county, so having them embedded with our sheriff, because our county covers a lot of the unincorporated areas, and then our second largest city, Denison, is going to be a part of that. So they are there. They're not there 24 hours, but they're there through most of the day, and we've seen a real impact. Less admissions to jail, less admissions to the emergency room, and more community health. Thank you.
All right, I'm going to turn it over to Judge Jan, and I just wanted to say thank you. He chairs the Forms Committee, and we just got, in my other hat as the court's liaison to the Rules Committee, we just got a bunch of updated forms to review, and we'll do that at our meeting on Friday. So.
Well, hopefully the forms will be good for you. I'm going to blame those on Judge Chu out of Travis County. We met several weeks ago in his office to iron those out with Ms. Harris. Going back to the court liaison position that Denton County got 4 years ago, Denton County Commissioners Court's been so happy with our court liaison's position that not only did they fully fund it, but they gave it a 6% raise this year. That position has had some mission creep that now kind of supervises the I'll call it pre-arraignment, pre-trial docket for 2 misdemeanor courts, as well, and is a feeder into the assistant outpatient treatment program, which we got a grant for earlier this year. So we've been really pleased with it. I know it's changed a lot from its initial inception 4 years ago, but it has absolutely, as Judge Phillips said, been a force multiplier for us, and we appreciate it and encourage everyone else to try and get one.
Other announcements from our committee chairs or anyone on the commission?
I just wanted for the judges who hear criminal cases, and this has been true in the past, but Article 46C 263 for court-ordered outpatient or community-based treatment and supervision for people who've been acquitted. And I heard the presentation earlier about people who have been found not guilty by reason of insanity and the time that they were spending in the hospital. Well, now the amendment is 463D. The court may order that supervision of the acquitted person be provided by the appropriate CSED, the probation departments, or the facility administrator. And the court may order that the acquitted person participate in the program funded by Takumi. So I'm looking at Emily here through that. So I brought this up at the leadership for the Texas Department of Criminal Justice and the Community Justice Assistance Division. As probation directors, we have to start partnering with our local LMHAs to be able to create a program, because in order for the judges to place somebody on the supervision after the person's been acquitted, we have to present a supervision plan along with a treatment plan.
Anybody else? Beth Lawson.
Good afternoon. I just wanted to take a quick moment to share some joy in that Lubbock and Star Care Specialty Health System are on the precipice of opening our new expanded extended observation unit. So when Chief Stanek was talking about that, I was just like, okay, go Star Care. We have been operating out of a retrofitted administrative building where we used to have mailboxes and now we have people. So it's really nice to have some funding from our city and county's ARPA allocation. But in addition to that, I would like to take a moment to clarify a question that you may have in your mind, or you may not have thought of it yet. Dr. Simpson talked about the Lubbock Psychiatric Center. I want to be very clear that that is not Sunrise Canyon Hospital. As you know, Sunrise Canyon Hospital is a 30-bed inpatient unit, the only one operated by a local mental health authority at the moment. And we received a blessing of some funds to expand, actually double in size. The Lubbock Psychiatric Center is a state hospital that is a maximum security unit. It is for inmates who are manifestly dangerous, who have charges where they cannot come to my hospital, and they will only receive referrals from jail. So the Lubbock Psychiatric Center is a 50-bed psychiatric state hospital in Lubbock, MSU, and it is in addition to what will be in our community, our 60-bed not maximum security unit at Sunrise Canyon Hospital. We be looking in your inbox in the early spring for a ribbon cutting and a personal invitation for me to come out and see it.
Yes.
Hi, it's Judge McCollum, but I'm leaning over here which is, this is mostly a kudos, and it speaks to the power of this networking, which is because of this networking, Devin Anderson and I, so she's with Justice Forward, she knows that we were a brand new startup on a veterans court there in Fort Bend County, and they came out from Houston. She brought out her veterans court team several times to watch our veterans court, and so the result of that is now a kind of collaborative MOU that they are granting for our veterans court, and it really is going to be a wonderful partnership that we are both looking forward to, but it really does speak to the encouragement of taking advantage of these relationships and the networking that this group offers. So thank you for that.
Thank you, Judge. That's terrific, and thank you, Devin. Okay, I think we're getting close. I'm going to let everybody have a little bit of a break. I hope to see all of you at the Diversion Center. I just want to echo my thanks to Wayne. I'll do that in person. He may be on his way over there to get
Yes, Judge, he
to get
stepped
ready.
out a little early. This is Denise Onken. He asked me to cover for him, but he asked me to just be sure and welcome everybody to Houston. Wayne is on his way over to the Diversion Center to greet and meet everyone who comes over on the bus or whatever way you're getting there. And it's a great facility. You'll enjoy the tour tremendously. I know we have both talked about it a lot over the years, so it's a great opportunity to see it. So welcome to Houston.
Great. Thank you, Denise. And Justice Huddle and I hope that we get to visit with you guys this afternoon, because we have 10 oral arguments Tuesday, Wednesday, Thursday this week. So we are coming, we came for the meeting, we're going to the tour, but we have to go back to Austin and be on the bench tomorrow morning. So we will not be here. But, of course, the great thing about having a joint Court of Criminal Appeals Supreme Court Commission is that we are leaving you in very good hands with Judge McClure and Judge Parker. And I'll hand it off to you now, Judge.
All right, so we are adjourned. Our next meeting will be in the new year on Zoom. If you are going to the center, Kama Harris and Rose McBride are your cruise directors, so please follow them. I'm sure they'll be holding umbrellas in the air or something like that. So thank you very much for participating in the meeting. We look forward to seeing you either this afternoon or tomorrow.
I want to add, if you were on collaborative council and didn't think you were going to get a seat on the bus, I think some professionals have been tied up and that we have some seats where we can take you over on the bus. So please meet everyone at 2:45 out here in the lobby. So you get a little break, and then we will head over and be back by, I think we're hoping about 5:30.
And everybody who's dressed up, if you want to change and be more casual, feel free.